Hi there, welcome back. We're on the second week. Hopefully this breathing that you've done over the last week has started to allow you a deeper connection to your abdominal wall, but also just more space in your body in your postpartum transition. So what we'll do next is a little bit of fascial release, myofascial release for your abdomen to get you in a better position to be able to use those abdominal muscles again. So we'll be lying on our back. We do need to be up against a wall or a headboard. You can also do this on your couch and use the back of the couch, but we need something to support our legs on. So comfortable position to lie on the back, and we're gonna let the legs fall into that surface. Now it's really important here that the opposite side rib cage stays rooted to the surface underneath it. So for me, legs are falling to the left, right side ribs are gonna stay anchored. So I like to keep a hand here just to remind me to keep those ribs down. And then we're just gonna start to do some gentle abdominal massage. So really gentle pressure, little circles around the belly, all around. Make a circle. You can do this as many times as you want. If you have a core ball, one of those squishy balls, you can use the core ball to do some abdominal massage as well. Once we've encouraged some more blood flow to that area, we'll get a little bit deeper into the obliques. So maintaining that gentle pressure to keep the rib cage anchored, you want to take your fingers and just start to scan from side of the waist across toward the midline. So obliques get really dominant in pregnancy because those rectus abdominis muscles, those six-pack muscles, start to separate to accommodate growth of baby. So we want to start to release the obliques so that we can give the rectus abdominis the opportunity to come back into the equation when we're ready for them. This is also going to help tremendously with lower back pain, hip pain, and also probably just generally discomfort in postpartum. So working your way from top to bottom of the rib cage, long strokes from the side of the body all the way across to the midline. And you can repeat this as often as you need to. It should feel really, really good. Once you've done it a couple times on this side, we're gonna switch sides. Make sure, please, in these early weeks that you are rolling over and pressing up to get up. We never wanna sit up directly. It puts a lot of pressure on the abdominal wall that it's not prepared for. So, getting to the other side, exact same setup. Knees rest. Make sure that you have one hand anchoring the rib cage. Start again with gentle massage all around the abdomen. So once we get into that slight rotation with the legs, we want to make sure we're giving the entire abdominal wall some TLC before we get into the nitty-gritty. Once you feel a little more warmth in your abdominal wall and a little more connection to that part of your body, that's when you know it's time to move on to that oblique massage. So the release is the same on this side. Anchor the rib cage, start from the waistline, gently move your way across. Long strokes here, just giving you a deeper connection to a part of your body that has been through tremendous amount of change over the last 9 months at minimum, depending on how far postpartum you are. Creating this connection is going to be so imperative to rebuilding the foundation of your entire core. So make sure that you take your time here and do this for as long as you need to and as often as you need to. Pressure should be fairly soft. We're not trying to dig into the deeper layers of tissue. This should not feel like a deep tissue massage. This should feel soft, gentle, and sustainable. And once you are done, you gently roll over, come up to seated, and then just give yourself a little movement side to side, just a little ribcage isolation, just to encourage, now that you're a little more open, encourage a little more mobility in the body. And that's it for today. I'll see you in a couple of days and we'll work on mobilizing the pelvis.